Hey there, nursing students. Today we're diving into the essential guide to mastering cystoscopy, a procedure you'll definitely need to know for the Nclex. Let's break it down step by step so you can ace this topic with confidence. First off, what is cystoscopy? Cystoscopy involves inserting a cystoscope, a thin tube with a camera and light, through the urethra into the bladder to check out the interior lining. It's a key tool for diagnosing and treating various urinary issues. So, when is cystoscopy indicated? It's used for diagnosing hematuria, unexplained urinary symptoms like pain or frequency, suspected bladder tumors and bladder stones. On the therapeutic side, it helps with removing bladder stones, taking biopsies, treating urinary obstructions, and even delivering medications like chemotherapy. But it's not for everyone. Absolute contraindications include severe urinary tract infections, certain cases of urethral stricture, and uncontrolled bleeding disorders. Relative contraindications: think recent pelvic surgery and pregnancy, which are considered on a case-by-case basis. Alright, let's move on to the procedure steps. Preparation involves getting informed consent, positioning the patient comfortably, usually supine, and administering pre-procedure meds like analgesics or sedatives. During the procedure, the healthcare provider will cleanse the genital area, possibly apply a local anesthetic, and gently insert the cystoscope through the urethra into the bladder. They might use saline or sterile water to fill the bladder for better visualization, then examine the bladder and urethra, taking biopsies or performing necessary interventions. Post-procedure, monitoring for complications and giving recovery instructions is key. As for nursing interventions, pre-procedure care includes assessing the patient's medical history and allergies, educating them about the procedure, and making sure they void it before starting. Post-procedure care means monitoring vital signs, checking for complications like hematuria, pain, or infection, encouraging fluid intake, and educating the patient on what to expect and when to seek help. Now let's talk potential complications. Infection is a risk, so watch for fever, chills, and increased urgency or frequency. Bleeding, usually mild, is common, but significant bleeding should be reported. Bladder perforation is rare but serious, leading to urinary leakage and infection. Urethral stricture could occur in some patients, and of course expect some pain and discomfort post-procedure. Patient education is crucial. Tell them to expect mild discomfort and bleeding for a day or two, drink plenty of fluids, and report any signs of infection, severe pain, or persistent bleeding. Also, emphasize the importance of follow-up care and understanding their results. Alright, let's wrap up with a couple of Nclex practice questions. First, a nurse is preparing a patient for a cystoscopy. Which action should the nurse perform first? A. Administer pre-procedure medications. B. Obtain informed consent. C. Educate the patient about the procedure. D. Assess vital signs. The answer is B. Obtain informed consent. Next, after a cystoscopy, a patient reports burning with urination and pink-tinged urine. What's the nurse's best response? A. This is unusual, I will notify the physician. B. This is expected, it should resolve in a few days. C. You might have a urinary tract infection, we will need to test you. D. You should drink less fluid to avoid discomfort. The answer is B. This is expected, it should resolve in a few days. Understanding cystoscopy, its indications, procedure, nursing care, and potential complications is critical for effective patient management and Nclex success. Keep these details in mind, and you'll be well on your way to confidently providing care in clinical settings. Thanks for watching and happy studying.